In your experience, because you've delivered thousands of babies, in the patients that you've had with multiple sclerosis, throughout their pregnancy, did their symptoms get worse? Multiple sclerosis is a disease that can be very tough. Pregnancy could be easy or it could be tough. It just depends. But did you know that there are doctors that are specifically trained to take care of patients that have MS and have very tough pregnancies? Today, we're going to get to talk to a highly trained physician that takes care of not only pregnant patients, but high-risk pregnant patients. We're going to get an opportunity to talk to not only an OB, but an OBGYN that is a maternal fetal medicine doctor. You don't get this opportunity very often to speak with a doctor like this, but today I get to interview a said doctor. Her name is Dr. Danielle Tate. Please help me welcome Dr. Danielle Tate. Many women have healthy pregnancies. Many women have MS. But are they mutually exclusive? Can MS patients have healthy pregnancy?
The simple answer is yes, they can. And that's great news. As with many conditions, a pregnancy can be healthy in the setting of the condition as long as we do what we call optimize. So make its best going into the pregnancy and just monitor closely. And most times that takes not only seeing your obstetrician, but also a high-risk pregnancy doctor like myself and staying in contact with your other specialists. So your physical therapist, your neurologist, and it's a team effort to make sure that's a healthy pregnancy. Yeah.
In your experience, because you've delivered thousands of babies, in the patients that you've had with multiple sclerosis, throughout their pregnancy, did their symptoms get worse?
Actually, it's the opposite. Symptoms get better. Conditions like multiple sclerosis consider the very broad umbrella of what would be considered autoimmune or autoimmune-like conditions, where at times your body will attack itself, causing the major issues with the condition. And here's the secret with pregnancy, your immune system actually turns down. So that system weakens to protect your baby. That's half not you from you.
Right.
And therefore you get the advantage of being more symptom-free during pregnancy. So the general rule is how you go into pregnancy is how you'll stay. And so that goes back to the conversation of making sure you go into pregnancy your healthiest. So that'll stay that way.
Okay.
Now, the opposite happens after you deliver, and we may touch on that in a little bit, and that system starts to wake up again. So you may experience some more symptoms, but that's why it's good to have all of your doctors in care so that you can be prepared and they can make the best plan for you throughout the entire time.
You bring about a very key point that I'm not sure people, not just MS patients, but all people, that you need a team to take care of you. You don't need one physician. And your entire team needs to be in communication with each other, because it just makes sense that if you have multiple things going on with you and multiple physicians, each of the physicians needs to know what the next physician said so that they can take the best care of you, the patient. You're the least common denominator. So everybody who's taking care of you needs to know.
Absolutely. Least common denominator, but absolutely the most important person on the team. And we all see things from different perspectives.
Exactly.
So it's always great to have that team look at things, because the way I view it may not be the same as the neurologist, may not be the same as the obstetrician,
Exactly.
but we all have good points to make
Exactly.
and great ways to look at it to stay healthy.
Because the primary objective, you need to get the best out of the deal, being as forthright as possible with as many members of your healthcare team as possible, or everybody on your healthcare team is perfect. Thanks for that. Thank you. The next question is, it has a very tricky way of showing up in more than one person in a family. With that being the case, is it possible for MS to be passed on from mother to baby? Or is it a genetic component?
I'll tell you.
All right.
It's a great question. Right?
Yeah, okay.
We have to build a suspense, right?
Okay.
Pause. Okay.
If you made it this far, I really appreciate you. I would appreciate also if you like, comment, and subscribe, and share with other patients or people that you think would find value from this video. Thank you very much.